If I'm right, his heart will stop. I care about your son, and have therefore brought a professional defibrillist.
Okay. I'll take him off.
Okay, I love the build up here. This is such a hyped moment, and it's amazing how House creates those. Like the switching off of a life support machine, taking out the pacing wire, or giving a patient arsenic for sleeping sickness. Very excited to be reacting to House MD Season 4, Episode 7, Ugly. On this channel, we are reacting to all 177 House videos, and this will be episode 88. Let's see if I can get the diagnosis before House does as a doctor working in London.
Get away. Get away.
What's wrong with him?
It's okay, Dad. It didn't bother me. Tomorrow at this time, I'm scheduled for surgery.
Kenny has a frontonasal encephalocele. He's here to undergo a facial bipartition.
Heart rate skyrocketing. He's over 180.
He's in VFib.
Paddles, charged at 300. Turn that camera off. I said turn that damn camera off. What?
Imagine walking down the street and having people just scream at the sight of you, and not in a good way. What is actually on his face though, and why can't they just chop it off? It's essentially an abnormality of brain development that causes some of the brain to stick out. Although it may seem like the brain is an unnecessary organ, considering how some volunteer not to use it, we can't rid him of that option. So how is it repaired? You essentially take out a bit of skull, lasso that rogue brain back in, then close the gate by fixing the skull and dural defect to keep the brain where it's supposed to be, inside your head. The fact that the heart rate went up is a little worrying though. It's unlikely to be brain swelling because that causes something called Cushing's reflex, which reduces the heart rate rather than increasing it. Maybe there's a problem oxygenating him that could cause the heart rate to seem higher than it is, and SATS probe could have been disconnected. Let's get more clues.
We have the patient on a pacing wire. Until we are able to figure out exactly what is causing the heart block, the reconstructive surgery is on hold, obviously.
I will see you again after I have saved his life.
Darnell will be trailing you throughout the case.
Let's go for a walk.
Oh. So what caused Big Head's heart to stop?
He has a midline anomaly on his head. Makes sense he'd have a midline anomaly in his heart, too.
The 16 years of testing didn't show. Blackened skin under the nose equals frostbite from huffing Freon.
Discoloration could be acanthosis nigricans.
There's also discoloration on the cheeks and forehead.
Do a nuclear study. I think she might be an idiot. She can't be an idiot. She's in the CIA, for God's sake.
If only House was the only person hiring based on looks. I'm reading this psychology book called Influence by Robert Cialdini. Great book, and he has a whole section talking about advantages that physically attractive people get. Good-looking people earn on average $230,000 more over the course of a career. They're more likely to get help if they're in need and are more likely to be persuasive. One study in Canada even found that political candidates who are more attractive get 2.5 times more votes than their less attractive counterparts. The advantage isn't just for adults either, as teachers presume nice-looking children to be more intelligent than their less attractive classmates, likely leading to more support. At first glance, that seems quite unfair and has definitely been criticized as such, but the science also shows that beautiful people are actually more intelligent. Don't shoot the messenger here. Kanawaza and colleagues studied this in 2010 and found that beautiful children on average are 12.4 IQ points smarter. There are two explanations for this. First is the nature argument. Intelligent men are more likely to achieve high status. High status men are more likely to mate with more beautiful women, and intelligence and beauty are both heritable, and now the parents have a mix of both. Or there's the nurture argument that we treat good-looking people better and therefore give them more confidence, which in turn makes them more competent, as that confidence carries them forward. As with most things in science, the truth is probably a mixture of both nature and nurture. For the nurture part though, AI may have a role in equalizing, as it could be used in job selection to make sure people are selected on their competence rather than their looks. What's even more interesting than that though is we have a new clue: darkened patches under the nose and forehead. So what could that mean? Well, House thinks it's evidence of him sniffing a refrigerant called Freon, which I had never heard of and had to look up. It's a type of chlorofluorocarbon that is known to cause damage to the ozone layer, so has been banned since the 80s. That makes this option quite unlikely. The other option the team mentioned, which is much spicier, is acanthosis nigricans. It's a skin condition caused by overproduction of a hormone called melanocytic stimulating hormone. It causes pigment cells in your skin to start producing on overdrive. It's classically associated with Addison's disease and has darkened areas under both armpits and in body folds or creases. That doesn't cause heart block like this patient has though, although I think there was a bit of a boo-boo earlier. You see, heart block causes a slow heart rate, and the team mentioned that the heart rate was increasing just before the cardiac arrest, which isn't quite right. Ignoring that though, and assuming it is heart block, then Addison's disease could explain all the symptoms. That's when your immune system attacks your adrenal glands and destroys the outer layer called the cortex, which can lead to adrenal crisis and potentially heart block. It'd be very easy to reverse with steroids, and so that has to be my first diagnostic guess.
She had good ideas in Langley.
All your ideas. If she's no good, just fire her.
I can't. I just hired her. She left a career.
My son is not huffing Freon.
Mr. Arnold, Dr. House is like a savant when it comes to diagnostics.
Can I have some for my headache? Study showed no signs of scarring in Kenny's heart.
It wasn't drugs.
Decreased uptake on the membranous septum. Do an EP study.
House is like a savant of diagnostics, so me choosing to take him on is like prime Mike Tyson being challenged by a gentle breeze. Except on occasion, that breeze short circuits a traffic light, so Iron Mike never makes it to the fight. Speaking of gentle things though, the membranous septum that House was talking about is what seems like the most unimposing tiny bit of flesh, but it's so much more. You see, the heart is made of 4 chambers, 2 at the top, 2 at the bottom. The bottom ones are stronger, more muscular chambers, and to keep them separate, there's something called a septum between them. Most of that is a thick muscular layer, which gets all the attention, but the small concentrated thin layer holds a massive amount of electrical connections between the electrical signal generating areas at the top of the heart and the receiving areas at the bottom. House is saying that this area was taking up more signal, which could indicate damage, and so wants to check the electrical activity of the heart with an electrophysiology study to see what's up. They basically put thin tubes into the heart and give small shocks in different areas to see how it responds. The thing is, this guy has just recovered from a cardiac arrest, and so the risks of doing this could be higher than someone healthy. There's also that risk to not figuring out what's wrong with him called death, which just so happens to be a pretty strong motivator. House wants to do this study because he thinks if drugs wreck the heart, then this could find it. Question for you smart people: what percentage of adults have done drugs in the last year? Answers down below.
If I did drugs, that could explain my heart problem, and then you can do the surgery to fix my face.
That's why we're here.
Coke. Mostly a lot of coke. And then when I run out, I usually go to LSD or acid.
Those are the same thing. You don't do drugs, do you? I need you to turn on your side. We need to intubate. I need some help in here.
Stomach cancer. Tumor causes bleeding. Body's reaction to the tumor causes perineoplastic syndrome, which leads to heart block.
Run the scope, find the tumor.
Pretty girl kill again?
Nope. Elephant boy just vomiting up blood again.
Heart block plus liver failure could mean autoimmune, maybe scleroderma.
Does that make sense?
Not without tight skin on the hands, muscle weakness, and a 30-year-old patient.
Are you serious? I see what Universal are trying to do here. Yeah, the new girl is making silly suggestions and needs to get axed, but come on. Discounting scleroderma because it doesn't have the classical presentation. Since when did anything House diagnoses present in a classical way? They diagnosed a skin infection from seizure, an extra vessel in the heart from a clot in the arm, an iron overload from a patient smacking someone in the head with a chest timer. Oh yeah, we get 4 of those a day in our emergency department. Either way, what would a good diagnosis for this patient look like? He's got heart block and vomiting up blood, which they're saying is because of liver failure. I mean, he would also be yellow and have a massive belly if that were true, but let's assume that it's true. And this skin discoloration as well. What if these skin discolorations are part of a multiple tumor syndrome? The reason why there was higher uptake in the heart could be because there's a little tumor there blocking the conduction system. The problem in the liver could be a tumor there and dark patches on the face could be a clue as well. A condition called neurofibromatosis type 1 can actually cause these usually innocuous birthmarks called cafe au lait spots to form, and that would fit this patient's symptoms so well. It's caused by a mutation in the NF1 gene, which codes for neurofibromin. That regulates cell division, and so when the protein is dysfunctional, then tumors can start to form, particularly non-cancerous ones on the nerves. It could explain all the patient's symptoms, so it has to be my second diagnostic guess.
Liver failure plus heart block could be a mitochondrial disorder.
Go look for signs of retinal degeneration.
No, it's ICP. You're only going to see swelling.
Take him with you so he can see the degeneration too.
Did House treat you as badly as he treats his current fellows?
I love Dr. House. I loved being around him professionally.
They forked, and then they spooned.
But there was no whisking away at the end of the draw. This camera crew is definitely not bringing out the best in House's team or ex-team. I like this episode. I think it's showing that the department need to be able to bend the rules to help the patient, and being in the spotlight constantly is risking their ability to do that. Not once this episode have we spoken about breaking into the patient's house. What's going on? We also had a new idea from a team about a mitochondrial disorder. That is interesting, as we've not heard anything about where the mother is, and we inherit all of our mitochondrial DNA from our mother. So it could fit if she was unwell, but what even are mitochondria? There are cells, batteries. They take glucose and turn it into energy. You can imagine then that if there's a disruption of this process, that can affect any part of the body, including the brain, heart, liver, nervous system, or eyes, as all of these have high energy requirements. House therefore wants to check the eyes to see if they're affected, but you'd basically need a genetic test to confirm it. We know the eyes are the window to the soul, but will they lead to our diagnosis? Let's find out.
There it is. Swelling, no degeneration. It's not mitochondrial. Swelling proves there's increased pressure in his brain.
Yes, this kid has a big head, and big heads cause pressure. JRA explains all of it, including the liver. One theory is better than two. Treat with steroids.
I think Dr. House is wrong, and that the steroid treatment could be dangerous. I think I can get House thrown off the case.
You're fired.
You're not fired. Do a CT scan of the kid's head. If there's no midline shift, we know Taub's wrong, and you get your consent to give the kid steroids.
Is Dr. Taub available? Do you know why he left?
He had personal issues to deal with.
Partner said that you left for personal reasons, but your wife said you lost a patient.
Son of a bitch, you spoke to my wife?
Are you serious? House booked a consultation as a patient with Taub's ex-boss just to get dirt on him, pick a fight with House, and expect scratching, sand in your eyes, and to lose a testicle. While these two cat fight it out, we have a new clue though: swelling of the brain. House thinks it's rheumatoid arthritis, Taub thinks it's raised pressure in the brain, which isn't actually a diagnosis, it's a sign of many diagnoses. It's like someone asking you what 5 + 5 is, and you say, it's more than 8. But less than 800. Technically you're right, but not technically. There was a slight room for improvement. So what is juvenile rheumatoid arthritis that House thinks it is, and how could it cause this patient's symptoms? It's an autoimmune condition likely because of an abnormality in immune regulation that affects children under 16. It can cause arthritis in almost any joint, which this patient doesn't seem to have. What he does have though is heart block, skin discoloration, bleeding from the stomach, and now brain swelling. How can they happen from a joint condition? There is a rare complication called macrophage activation syndrome, which basically causes an overwhelming immune response from, well, macrophages. It can lead to high fever, enlarged liver and spleen, enlarged lymph nodes, low blood counts, and brain swelling. It does get better with steroids and immunosuppressive meds, but they definitely want to do some antibody screening and blood tests first, as if it's not that and he has infection, that could trash his immune system. Now, if you want to trash your Netflix subscription so you can watch my reactions, then check out the channel membership. You get early access to new videos, access to exclusive polls, and to suggest a series and episode for me to react to. The first 30 members get a chance to win a 1-hour, one-on-one tutor session with me with a topic of your choice, and we currently have 26 members with only 4 spots left. We're so close. Press join now to secure your spot, and I'll keep working tirelessly to make it worth your while.
I screwed around with a nurse. My partners found out, and I resigned. Some people pop pain pills. I cheat. We all have our vices.
Taub has a very interesting point. Although that is part of the problem. We hear about vices a lot and how undesirable they are, but a 17th century moralist and writer called La Rochefoucauld thought slightly differently. He thought that the numerous faults found in our virtues are necessary to alleviate the ills of life. The traditional vices he was referring to are things like greed, prejudice, cruelty, hypocrisy, dishonesty, arrogance, and being overly emotional. Many religions and moralists try to eliminate these things like they're a crease to be ironed out, but could you have a society without these things? Flattery and hiding true intentions can be a strong social lubricant. Deceiving yourself willfully can lead to confidence and contentment, which is important for those that are less talented. Jealousy, aggressive ambition, and vanity can fuel new discoveries, businesses, and even scientific theories. So rather than trying to eliminate these things, we can understand that they're an inevitable part of a society with hierarchies that's goal-oriented, in which people have different capabilities. That doesn't mean go on a drug-fueled binge to Bangkok, because trust me, that story won't have a happy ending. Just if you happen to stray off the conventional path every now and then, don't beat yourself up too much about it.
House, start steroids and stay away from his family.
Wow, you are ugly. Anywhere else in the animal kingdom, your parents would have eaten you at birth. Take your steroids, and you get to live. And you can do your surgery. We're gonna get caught. I'm not on film. All their camera equipment's in here.
Dr. House, heart block plus liver failure could mean autoimmune, maybe scleroderma.
Can't believe I'm that guy.
Every guy is that guy.
Cameron was smart.
You know, I'm beginning to doubt that.
His little finger is twitching. There, he's not better.
Whoa, wait a minute. Finger twitching? Are you serious? Okay, this just made my first diagnostic guess way more likely. There are a few things to consider here. House has been going through this war with Taub the whole episode, and yes, Taub's raised pressure theory got disproven, but you know what else he suggested? Acanthosis nigricans. If that was caused by Addison's, then that would explain the twitch. But how does Addison's cause twitching? Addison's damages the adrenal glands, reducing the hormones that come out, like aldosterone. Aldosterone usually helps reabsorb filtered sodium from the kidneys, and so low levels could cause the blood sodium level to fall, leading to twitching. If that's it, then that would be an insane diagnosis. In all fairness though, I would prefer if one of the girls got the diagnosis right. Like, can you imagine if it was actually scleroderma now, after they kept calling the new lady an idiot? That's almost worth spending a diagnostic guess on just for the story, although I might hold off just for now. Question for you smart people, are there more men or women with IQs over 170? How many times more? Answers down below.
I don't know what he has. Cancel the surgery.
Why can't you just accept the fact that you cured this kid? You want to stop his surgery. Let's test your theory. Remove his pacing wire. If he's better, his heart will be just fine on its own, and then he can have his operation.
If I'm right, his heart will stop. I care about your son, and have therefore brought a professional defibrillist.
Okay. I'll take him off.
Okay, I love the build up here. This is such a hyped moment, and it's amazing how House creates those. Like the switching off of a life support machine, taking out the pacing wire, or giving a patient arsenic for sleeping sickness. There is this thing you can do with pacing wires before taking them out permanently though, and exposing him to another of Kuttner's incendiary life-saving maneuvers, switching the pacing off. In fact, if pacing isn't needed, it's so high-tech nowadays that it switches itself off. Think about it, if the heart's beating by itself, then why do we need to keep shocking it? Still love the suspense it makes though, especially with Kuttner holding the paddles. He's electrified oxygen, he's electrified water. What's the patient going to be covered in next? Kerosene? That's one way for a career to take flight. You see, in real-world medicine, we like boring. Boring is good. Boring means smooth, and smooth means happy, healthy patients who would prefer not to sue you and destroy your career, unlike House's patients, well, until he saves them. Alright, let's see what happens next. I still have one diagnostic guess left.
Heart rate's 85 beats per minute. BP 110/70.
I feel the same.
Thank God. God's the guy who gave it to him.
They don't want me here because they think the kid's cured. I don't. When were these pictures taken?
Well, about 3 weeks ago. Why? What do you see?
Well, the acanthosis nigricans was already there. What about around his hairline?
What? There's no discoloration.
There is now.
Okay, this is my last chance to get it, and we have another clue. New discoloration around the hairline. So maybe they discounted the acanthosis nigricans because it'd been there a while, and the hairline thing is less about the hairline and more about the fact that the underlying disease process is actually worsening. There is more than just Addison's that can cause acanthosis nigricans though. Diabetes, Cushing's syndrome, low thyroid levels, psoriasis, and cancer can all cause it. One of the spiciest causes could be cancer, but where would it be? I have no idea. All right, I'm just going for lupus as my final diagnostic guess because, well, it's house. I know it's never lupus, but it could be lupus.
You were right about being wrong. He's got Lyme disease. It explains everything. The target rash is hiding. No one ever looked at him closely enough.
She's getting uglier by the second. So you gave up your chosen career just so they'd be quiet.
I love my wife.
Sit back down. Dr. Terzi, would you please stand up? You're fired. You want to grab some dinner?
In the end, it was Dr. Gregory House who served as not only a doctor, but a rock for Kenny and his father.
It's difficult not to be moved.
Thank you, Dr. House. Thank you.
Lyme disease! Lyme disease! Brilliant by the team. They got me there. The thing is, I could have figured that one out as well. The episode title is ugly, so of course people won't look so closely at him and may miss the rash. Also, that female beauty was a big part of the theme of this episode, so it would make sense from a story perspective that it would come from a female team member, and 13 did suggest Lyme disease earlier as one of the differentials. Really cool episode, 8 out of 10 entertainment, 7 out of 10 accuracy, I'd say 9 out of 10 diagnosis. These season 4 episodes are insane. Love the way they hit the rash and wove that into the story. This episode doesn't make full sense until you watch the previous one where House gets invited to the CIA here.